Heart failure basically deteriorates normal bodily function. I think the one statement that somebody said to me is, it's like being old before your time. Things tend to slow down. You can't do the things physically that you were capable of doing.
The Heart Failure Policy Network is an independent group of patient advocates, clinicians and policymakers from across Europe. We've been active since 2015, working to drive greater government recognition of heart failure. Our latest project, Heart Failure Policy and Practice in Europe, is arguably the most comprehensive assessment yet of government strategies in heart failure, as well as the realities of healthcare for the millions of people who live with this condition.
Based on the literature and input from over 50 heart failure experts from across Europe, we identify 5 urgent actions that are needed in most, if not all, countries analysed in this study.
So there's a need to increase awareness among the general public, among healthcare professionals, and among decision makers. Only then it's possible to start addressing the challenge.
Heart failure is a very misunderstood and very little known disease, despite all of the advocacy work that has been done over the years.
Access to NP testing is very important in the diagnosis of heart failure, but reimbursement policies often fall short. It's important to reimburse NP testing to help healthcare professionals recognize the value of this test and to promote its use in clinical practice.
GPs are the first contact points of most patients with heart failure symptoms. If GPs do not have access to NP testing, they wait until symptoms are very obvious before they refer patients for further investigations.
The role of heart failure specialist nurses is still not widely recognized across Europe. There's a need to accredit and fund heart failure specialist nurses. This will foster an interest in the role and will contribute to a workforce better prepared to manage heart failure.
Heart failure nurses have a pivotal role, an important role to play in supporting not only healthcare providers, but also people with heart failure to self-manage their condition.
I believe formal accreditation of heart failure specialist nurses adds value to the quality of care we provide.
Overall, there is a significant gap in tools that allow healthcare professionals to communicate with each other, to have access to a patient file so that they can better manage heart failure and support people living with heart failure. So it's absolutely critical that there are tools that promote this communication and systems that support these level of integration of care.
Heart failure patients need to go to different healthcare facilities to get different types of care. It's crucial that the patients have their file available to all the healthcare providers. And integrated care is easier if you have multidisciplinary IT systems that allow that information spans easily to different levels of care.
For best practice heart failure care to be a reality, it is crucial that reimbursement models recognize the value of integration of care. This can be done via the development of care protocols, pathways, and clinical networks, showing how the collaboration between healthcare professionals and care settings can and should be done in real-life settings.
The critical point is that the patient needs a clear patient pathway organization, not only with the specialists, but also with GPs, nurses, the patient education, and the families. So the critical point is all the patients need to be engaged in a patient pathway organization.
The healthcare systems are being stretched to their limits. Financially, it's a burden, and not every country is able to cope with it in the same way.
We hope that this work helps drive change. We hope that it helps improve the lives for the millions of people living with heart failure across Europe.